All right. Good afternoon.
Good afternoon. My name is Brenda Ruiz. I'm a volunteer with Slow Food Sacramento and the California Food Policy Council, a non-governmental statewide body of over 25 community-based food policy councils that provide nutrition education and implement obesity prevention strategies across the state. The makeup of these councils includes family farmers, rural community advocates, healthy food access advocates, as well as small business entrepreneurs and obviously public health professionals. It is vital that the state not only continue to partner with us in our work, but that also continue to provide the funding for this partnership and funding that we can access directly. And I say these things to you today, not as a subcontractor or even a grantee, which I'm not. I'm a chef by profession. I've been cooking in the Sacramento restaurant industry for over 20 years. And I speak to you today as a single working mom to a preschool age little boy. He's 4.5. And I'm part of this population. I'm part of this population that the SNAP Ed programs serve. And I can tell you, and I mean this personally, and give testament today, that moving the funding out of the communities and to create 45 state-level staff positions probably won't improve program or service delivery. And there's an often repeated quote, and it's that budgets reflect values. And I would ask this committee to reject the BCP as drafted today, and that it value, through its budget, value the relationships that community-based organizations have been doing and one-on-one relationships in our communities. Not only value the relationships, but value the work that we've been doing so well for so long. Thank you.
Thank you very much for your testimony.
Good afternoon, Madam Chair, members. My name is Matthew Marson with Public Health Institute, and we do, I will say, have the current contract with the Network for Healthy California Nutrition Education Obesity Prevention Branch, and PHI is proud to have contracted with CDPH since 1996 to administer this program, and in fact, we helped to build the program prior to that as well at the state, applying for the original federal grant. PHI is opposed to this BCP, and we're deeply concerned, though, however, this is not about our contract with the state. We're deeply concerned that the impact of this BCP will have on the broader SNAP Ed program in California and the impact on the local population that is served by the program. We strongly endorse the questions and concerns that have been raised by the federal funder USDA and have been referenced here this afternoon. And I do want to just identify a couple of additional concerns that PHI has, as well as many others across the state. First, the BCP would abandon a critical component that has been a tool available to the State Health Department to partner with nonprofit organizations, NGOs at the state level for chronic disease prevention programs. That combination of strong state leadership, local agencies delivering in their communities, and statewide nonprofits that can work to deliver excellence and expertise that's not available necessarily in the state, but can fill gaps and address needs that are not necessarily served either by the state or local agencies working alone. And I would acknowledge, I think, that the positions referenced by the department today that they're creating, the 45 positions, do not have the specialized skills in social marketing, community organizing, that we've been able to recruit, or others could recruit if competed openly through a contract, to serve the needs of the community within state service. Secondly, nonprofit organizations, NGOs, can leverage other resources and assets from philanthropy and other assets that can help to address some of the challenges we face in obesity prevention. As we heard today, those boots on the ground, those communities are facing a tremendous onslaught from the industry, the beverage industry, and nonprofit organizations like PHI, but others, are able to nimbly respond to some of those challenges and make sure that we're able to confront some of those insurmountable forces that we see. Another important note is that California's SNAP Ed funding is in decline. Because of federal law, SNAP Ed funding in California will be reducing every year by 10%, as the federal government has to shift those dollars to other parts of the state, particularly the southeast of the country, where there is much higher rates of SNAP participation, higher rates of poverty, and more rates of chronic disease. That's scheduled to run through 2018. In addition, last year, California SNAP Ed funding was cut by $40 million in 1 year alone. PHI led a national coalition and we were successful in having that California funding restored in the federal farm bill. However, it's incredibly vulnerable, and there is now a proposal by Senator Thune from South Dakota that, if enacted, would reduce California's funding by $100 million. We need to ensure that during this time of tremendous scrutiny, there is stability in the program, they have success in the program, and we protect California's program. Now, the BCP itself, although the department did acknowledge today the loss of these subcontractors, the BCP doesn't mention the loss of the funding for subcontracts. We currently administer 50 subcontracts with CBOs, local agencies, and they are going to faith organizations, they're going to youth groups, specialized vendors that provide special projects and support. And the department has acknowledged they have no mechanism themselves to continue this work. We are thrilled that the local health departments will hopefully be delivering these services in their local communities. However, I do want to acknowledge one point. The new grant mechanism, at least to our understanding, the grant mechanism that the department is now using does not require that counties subcontract these funds. The prior mechanism, up until FY 2013, did, but now the new grant mechanism does not. It encourages counties, and only over a certain threshold. That means that there will be areas of the state, particularly in rural communities, where they have small amounts of funding that will not be required to work with community-based organizations. For that reason, we are urging the department, come back to the table, come back with the BCP that includes perhaps an increase in state staffing, but at the same time includes competitive agreements that could be transparent, competed openly for groups like PHI, but many others to have an opportunity to apply for, to address some of those gaps in the service and the community. And then finally, I do want to acknowledge one thing is the mention this morning of the media contract. The department is challenged deeply with contracting at the moment. There is not currently a media contract for SNAP-Ed activities. Runyon, Salzman, and Einhorn had that contract previously. The department has not been able to rebid that. And so there is not currently a media contractor currently for the SNAP-Ed work taking place. And that we are hopeful that the department will put that on the street soon so that can be competed and we can have an opportunity to see media once again for this program. Just in closing, we're not opposed to this BCP in principle. We support the opportunity for increased capacity at the state of California. We want to see a strong state leadership. We would urge the department to come back to the table with a BCP that includes increased state staffing, but also includes a strong, comprehensive, competitive element for nonprofits to work statewide, as well as the regional work and local work we heard described earlier today. Thank you for your time and listening to our concerns.
Thank you very much. Next speaker.
I'm a little short, so I have to bring this down. Thank you, Madam. Thanks, everyone. My name is Christina Gunn, and I'm with Brand Meta, and I'm coming to you as a business person. You know, I've had experience working for a Fortune 50 company as well as for being an owner of a small business myself. And I do share the same issue as the California Department of Health in terms of the desire to want to decrease spending, the desire to want to make sure that, you know, we allot all of our activities into a most cost-effective way. However, allocating 45 position into a state agency, just arbitrarily doing that, I want to caution. I'm not saying it's the wrong thing to do, but I do want to please pray and have you guys really put caution into this. And one is, is the effect of disrupting a successful ecosystem. And we've heard it before this morning when we talked about the tobacco prevention program. And that program is an award-winning program that was very successful, and it really put a feather in California's hat. That program was a byproduct of the people and a process that implemented it, which are, the PHI, the local governments, the state agencies, everybody involved. And that was successful because of the people implementing the program. So some of these things that I also want to share my concerns with the proposal is this. In putting 45 additional headcounts and also to make the transition, I want you to carefully consider the increase in staffing needs with regards to training and bringing your new staffing up to the capabilities of the expertise that's already out there, the cost of certifying them, of licensing them, and finding them and recruiting them. The other piece is, there's a potential of putting the ownership to the local agency, but then in turn, they'll be tasked with individually finding their own expertise and resource, which will then bring us back to where we're at, which will then, because there's so many local agencies, you'll spend more of your efforts and maybe even have to spend more resources in finding a governance to make sure that they consistently report measure and, allocate the same way as you would. The other piece is also, I come from a business perspective of sometimes the best solution is the cheapest solution. It might not look like it from the very topical perspective, but at the end, it's done right, it's done efficiently, effectively, and at the first time. And lastly, the vacancy rates. It is a concern to me. 45 is a lot, and I know that there is an aggressive plan to fill those 45, but still realistically, you're looking at, recruiting, training, making sure people are up to speed and executing at the same professional capabilities as what you currently already have. It's not like what you desire to have. You currently already have that. And lastly, I just want to share that we represent Dr. Ed Hendricks, and he is the chairman of the National Obesity Treatment Foundation, headquartered in Denver. And he just came back from the UK presenting to the European Congress on the effect that obesity has to government and to its program. And since recently, he's been invited back to Brazil to present on the same thing. Obesity is a big epidemic that we're experiencing here in America too. It is something that's very big, very important, and very serious. And I honestly don't feel this is one area that we would want to mess with. Let's take what's already been proven, let's replicate success in the tobacco control program, and let's continue it, not diminish it. Thank you.
Thank you very much for your comments. I'm going to ask the remaining speakers, I'm very interested in what you have to say, but we have to limit the comments to just a few minutes, in that we should be concluding by about 2:30. So if the rest of the speakers can maybe speak just for a few minutes, I'd really appreciate it.
Good afternoon. My name is Stacy Cruz, and I represent the California Center for Civic Participation, a statewide nonprofit that engages high school-aged youth in community organizing and policy advocacy. And with this recommended budget change proposal, it would really impact our programs and impact the way that youth are engaged locally in community organizing. So I strongly encourage you to reconsider this, and we empower young people to be leaders and to be civically engaged in their local communities and on a statewide level. And by shifting the money away from the communities, you're taking away leadership programs from young people and from the youth in their communities. Thank you.
Thank you very much. Next speaker.
Good afternoon, Susan Forster again, and I'll try not to repeat any of the points that were already made. I just want to address from both a scientific and administrative perspective what this budget change proposal actually does. It would replace half of the employees that are currently delivering the Network for Healthy California services. You've already heard it'll eliminate 550 small contractors and business people. Our target is, and I say our, even though I've left the program, sorry about that, the program attempts to reach 12 million low-income parents and kids at a cost of about $100 million. So the late timing of this BCP is really very problematic. A couple of things. One is that social marketing initiatives, which is what this is, that's what USDA is paying for, requires atypical technical staff who have deep roots with the community, who have different kinds of discipline, background, and training and education than typical state classifications require, such as state classifications call for degrees in hospital administration, health administration, background in health institutions. That's not what this program is all about. And so one of the statements was made that it would be against the law to contract out again, but there is the government code and 2 statutes specific to nutrition that allow the department to encourage the department to contract out. Secondly, there was supposed to have been a good faith effort to develop new specifications or tailor existing specifications, but none of that has been possible to do. And in fact, at one point, we tried to get an African American specificity into a position, and that was rejected. So the 45 people would in no way be equivalent to the people that are already there. Third, the timeline is very problematic. The cycle for developing a state plan begins roughly in January, and all of the components are supposed to fall together by mid-June in order to be compiled and given to social services in mid-July to give to the feds by mid-August for approval of the money by September 30th. So you can see that the kind of chaos and disruption that 70 people leaving the program between now and the time that the decision is September 30th, and maybe 45 people coming on, is going to be very problematic. So I would just concur that there need to be some rethinking of the timeline and the methods that are used. Thank you.
Thank you very much. And I do need to ask the rest of the speakers, please, to be brief, because unfortunately I'm going to have to leave and there'll be nobody left. So my apologies, but please, thank you very much. I'm sorry.
My name is Carla Fitzgerald Williams. I'm an MBA by education, certified nutrition and wellness consultant. I'm here. I have no long-standing relationship to anybody in this room. I've had the privilege of working with the American Heart Association on their Power to End Stroke campaign, and additionally the privilege of developing recipes for them for families and specifically targeting African Americans. This is of deep concern to me as it stands now. I do community work in Los Angeles, specifically targeting low-income African American at-risk communities. This is a community that requires in the trenches culturally competent people and efforts in order to reach them. All of the research bears that there still remains a lot of mistrust in the community in terms of involvement with studies with outreach, really backing all the way up to Tuskegee. The campaigns that have existed to date via Champions for Change have been effective in reaching the community. There have been over 20,000 faith-based outreach, individuals reached last year alone through the faith-based. That may well be at risk if this goes to the state level because of the necessary separation between church and state. The African American community is a little bit different. The church remains at the core of the community. When you reach one, there is an accelerator effect that spirals out and reaches many to the families, to the community beyond. This community also responds to relationship-based in terms of who it's taking its health cues from. This was a cookbook that I received last year at a community-based Weight of the Nation outreach in Los Angeles. That shows you how effective this campaign has been in terms of reaching. This rivals the New York Publishing House's cookbook. Okay. This may cease to exist if this program exists. It's very, very difficult to turn a program around quickly enough to stop the spiraling of death and disability that's occurring in the African American community and the obesity. The way to stop this, I do not believe, is to take it in state at this point. It is to work to continue and to support the impressions that have been made through Toolbox Kids educational support, through the media efforts, the ads that were effective in reaching 85% of SNAP. I'm very concerned that if this goes through, we are going to back up, and in the time it takes and with the infrastructure that exists at the state level alone, it's too long to decision making. While all of that takes place and you muddle through whether or not African American can be said, is that outside of the law? Whether or not faith-based can be reached, we will have yet another generation that is growing up impacted by the scourge of obesity. The last point I'll make to you is that the campaigns as they have existed have increased the frequency of fruit and vegetable consumption. This is disease prevention, and that's what needs to happen in order to help our communities.
Thank you very much.
Madam Chair, Brendan Toohig on behalf of the American Heart Association and the California Center for Public Health Advocacy. We have concerns about the proposal, particularly in light of the concerns raised by USDA that are mentioned in the staff analysis. We don't want to do anything that will jeopardize this critical federal funding, and we also need to be assured that we'll continue without interruption to effectively reach hard-to-reach populations. So we appreciate your diligence on this issue.
Thank you very much.
Good afternoon, Rebecca De La Rosa with the Latino Coalition for a Healthy California. We have very similar concerns. We want to make sure that monies keep being invested in our community-based organizations to increase enrollment in these very needy communities. Thank you.
Thank you very much.
Judith Riegel with the County Health Executives Association. My members are the health directors of the County Health Department, so we are the local lead agencies for this program. Just wanted to really know that let you know that we are completely committed to making this model work. We are required, except for the smallest grants, to subcontract with community-based organizations. Even if we weren't, that's our model. That's how local health departments work. We know we can improve the health of our communities without involving our community partners, and we are committed to making that work at the local level.
Thank you very much.
I'll be quick. Kathy Mossberg, representing the California Association of Food Banks. We are opposed to the current approach here in the BCP. Just to state, we certainly believe and continue it in our programs that the community needs to be involved. So any movement to sort of remove that, we're concerned with. We also do want to have a conversation about this requirement. It's not our understanding that the locals are required. So we certainly want to have a conversation about that particular aspect. Look forward to sort of having conversations as this item is open. Thank you.
Thank you very much. All right. That item we will keep open. And we have one last on our agenda today.
We would be happy to address with you any of the comments that have been made today to clarify anything or provide any support. Thank you.
Thank you very much. Really appreciate that. Thank you. So our last item today is Infant Botulism Treatment and Prevention Program.
Good afternoon. I'm back. Gil Chavez, Deputy Director of Infectious Diseases. We have two items related to the Infant Botulism Treatment and Prevention Program. As you know, this is a critical program that provides life-saving medication to what is a very, very serious illness, and so we appreciate that you're always supportive of our efforts of keeping this on track. There are two proposals, and my colleague Janelle Chaps will provide an overview of those very briefly, and then I think we have a couple of items to respond to.
Good afternoon. The background information that was provided in the summary is very representative of the program, with one correction I'd like to make. The actual fees are paid for by either the hospitals that are treating the patients or the patient's insurers. It does not, the recipient of the treatment is not billed for those fees. So the Baby Big Botulism is the Department's public service orphan drug for treatment of infant botulism. The drug is distributed nationally to all the patients with infant botulism, and the FDA approved the use of Baby Big and licensed it to CDPH in 2003. The program was established as a fee-supported program, and the hospitals that treat the patients or the insurance companies of patients receiving the treatment pay for the fee. CDPH deposits the fee into the Infant Botulism Treatment Fund, which is used for the sole purpose of the development and production of the and distribution of Baby Big. The production of the treatment is separated into lots. We are currently dispensing from Lot 5 and developing Lot 6. So we have two proposals in front of the legislature right now. The proposals currently before the Senate are related to the increase in the current expenditure authority for the upcoming fiscal year for an increase from $6 million to $9 million, or an increase of $3 million is the ask in the BCP, and that would be for fiscal year 2014 and 2015. And an ask of an additional $951,000 in fiscal year 2015 and 16. The current fund balance is approximately $9.9 million. The usage has unexpectedly increased in the last several years. It was an all-time high of usage last year of 141 doses, which were administered. And the 5 to 6 year production cycle that is involved with the development of this drug is what drives a cyclical expenditure pattern, which is dependent upon the phase in the production of the lot and how much we spend. The majority of the production of Lot 6 will be completed next fiscal year in 2014-15, and that is what this increased expenditure authority will offset. The cost increases that we are currently experiencing are a result of expected inflationary factors, as well as 3 elements requiring FDA approvals, and those are the establishment of a new facility, the establishment of a new vaccine as required by FDA, and new equipment as well.
Thank you.
Second proposal?
The second proposal is to convert 2 of the existing 10 contract staff to civil service positions, which will strengthen the fiscal and administrative activities and oversight. These positions will manage and complete activities related to the development and execution of contracts, fiscal monitoring, and HR activities for the remaining civil service staff within the program. Currently, these activities are being performed by highly skilled medical and executive management civil service staff. This proposal will develop and assist in retaining permanent, knowledgeable, and skilled staff and will result in a savings of $46,000.
And in addition, as you know, we conducted a zero-based budget approach to the budgeting Baby Big, and yes. One of the things that we learned is that we needed to have tighter control over the administrative side of the production with state staff so that we could keep the cost closer to our eyes, if you will. So along those lines, item 2 on your proposal was an update on when you can expect to have a report that we owe you. And we tried very hard to get it done by today so that we could give it to Michelle and have the good news. But I believe that the report should be to Michelle by tomorrow or the day after at the latest.
I don't know. Is that good enough?
We tried.
Thank you very much.
Oil.
We appreciate that very much. Thank you. We'll look forward to it tomorrow. All right. Any comments by LAO or Department of Finance on this matter? Any public comments on this matter? Thank you very much. I was actually not aware of this program. Sounds very interesting, the fact that it was developed in-house. I'd love to talk more about that sometime. That's a great thing maybe we can do more of someday. Anyway, so thank you very much for your presentation. Any public comments on this matter? All right, this item will remain open. Thank you very much, and this meeting is adjourned. Thank you all very much.